GLP-1s help manage blood sugar for people with type 2 diabetes, but it doesn't seem like that's where the drug's usefulness ends. A lot of people on social media say that medications like Ozempic have made a big difference in their weight loss journey.
And now there are some people out there saying the drug has helped them with getting pregnant or managing PCOS or polycystic ovary syndrome. Our 9 News medical expert, Dr. Payal Kohli, is here to talk more about that. Thanks for coming in.
Good morning.
So first, where does this term Ozempic babies come from?
It was a bit of a surprise to us in the medical community because it started as a diabetes drug, then became a weight loss drug, and then women taking this who had been trying for years to get pregnant suddenly started becoming more fertile, started conceiving and getting pregnant naturally on it. So they coined this term Ozempic babies. Now, it doesn't just apply to Ozempic, it applies to essentially all GLP-1 receptor agonist drugs. And just to be clear, it's not approved for fertility. So this is not really a fertility drug, but this is a sort of an unexpected side effect that was pleasant that women are getting more pregnant on it.
Explain to us the connection between obesity and diabetes and fertility.
For the longest time, we hadn't understood this connection, but now we understand there's multiple levels of dysregulation that occur. So when you have obesity and diabetes, you have a chronic low-level inflammation. So when your body's in inflammation, evolutionarily, we turn off our reproduction, right? Because we're not really in the best shape to reproduce. It creates a hormonal imbalance as well that can turn off ovulation. And then we know that both diabetes and obesity are associated with insulin resistance. So your body makes more insulin. The more insulin you have, the more it interacts with the woman's ovaries and actually turns on androgens, the male hormones, to shut down ovulation. So all of this put together really creates a perfect environment for women, obese women, diabetic women, metabolic syndrome, or PCOS to not be able to conceive.
I want to ask a quick follow-up right there because, of course, it's not just women who are taking these GLP-1s. There are men as well. Is there any impact on male fertility?
Yes, in fact. So if you're obese or diabetic, we know that your fertility declines. And with Ozempic, we've seen that men who lose weight, they start getting healthier sperm counts. And actually, the quality of the sperm goes up as well. They've actually looked at the data across the board, and they say for every 1 point that your BMI is above 29, which is already getting pretty heavy, your fertility in a woman declines by about 5%.
Whoa.
So it's pretty substantial.
Yes. Does it affect how birth control works?
That's another thing we realized, and another theory for why there may be more Ozempic babies out there. So it's not just the hormones and the inflammation, but maybe women who are taking oral birth control pills, they're not working as well because the hormone works in the gut to slow the way that your stomach empties. So if the pill is sitting in the stomach longer, it's not absorbed in quite the same way in the body. So perhaps you're actually becoming pregnant because your birth control is less effective. And for this reason, a lot of people actually recommend a backup method of birth control for women who don't want to get pregnant while taking this.
How does a drug like Ozempic impact women with PCOS and their fertility?
So PCOS is a condition of hyperandrogenism. So you basically have your male hormones turned on, and it's called polycystic ovarian syndrome. And you can have, facial hair, you can have all these cysts on your ovaries, and your ovulation turns off. And it's usually associated with many of these metabolic abnormalities. So when you take Ozempic, it turns off those excess androgens and it turns back on ovulation. So it's one of the most natural ways to sort of restore fertility in these women. But here's what's interesting. It's not just about fertility PCOS, it also helps the symptoms of PCOS.
Really?
Because women with PCOS, because of their hormonal fluctuations, can have a lot of symptoms as well, and it helps them feel better with those.
How long do you have to be off the medications before trying to get pregnant?
Now, this is really important because the medicine can be in your bloodstream for 6 to 8 weeks. So if you actually want to get pregnant, you have to be off of it for 2 months. So what I'm telling my patients that are heavy, that are in their 20s, 30s, and 40s that want to conceive is that you use this medicine to get your body in better shape to carry the pregnancy, which is healthier for you and healthier for the baby, but you don't want to get pregnant while you're on the medicine. So make sure that you're using birth control with a backup method like an IUD or a condom or something else. But once you decide you want to get pregnant, your body's in that good shape, you want to stop it for at least 2 months in order to make sure it's completely out of your system because it can affect the baby. In fact, if you give it to rats, you can get all kinds of structural abnormalities, fetal abnormalities, all kinds of problems in the rats.
Yeah, absolutely. You want to let your body start to self-regulate once again. Well, Dr. Kohli, very interesting. Thank you so much. We appreciate it.